Hi, folks. This is Abnormal Psychology, and this video will be about agoraphobia. Agoraphobia is a specific type of anxiety that often accompanies panic disorder. And this particular kind of anxiety means that the person develops a reluctance to leave home and to go out into certain places, either because they are overwhelmed by anxiety when leaving the house, or in some cases because they have developed enough phobias uh, as a result of having panic attacks in those places or situations that their world essentially collapses. It narrows and narrows until being at home is the only safe place for them. Now, a person with agoraphobia could leave home, but they would not be able to do so without enduring great levels of anxiety. They would still qualify for the disorder itself. So you'll often see people with panic disorder and agoraphobia. Now, I have a film in your PowerPoint about an agoraphobic woman who has received some treatment, but she's not completely done yet with the occasional periods of not panic attacks per se, but enough anxiety that she becomes disoriented and perhaps even a bit dizzy and can't complete, say, an errand to the grocery store, which is depicted in the film. So I'd like you to watch that. So the diagnostic criteria for agoraphobia include marked anxiety about two or more different things. Public transportation, marked anxiety. Open spaces, marked anxiety. In fact, the word agoraphobia means fear of being out in the open or fear of the marketplace specifically. Okay. Being in enclosed places, like theaters and shops and so forth, being in line or in a crowd, and being outside of the home. And so agoraphobics may actually be completely homebound, you see. And that would be very, very bad because it would narrow your life experience and your life satisfaction. It could really be disabling. Okay? So the thing that links those places where marked anxiety may occur is that being in them brings about a sense of inability to escape, or that it would be impossible to receive help if you were there. Okay? All right. Now, those situations will almost invariably invoke considerable anxiety. For some people, even getting in the car is difficult. Going outside to get the mail may be very difficult. It's very difficult to predict exactly what will hit when and about what. But they will actively avoid those situations, and the fear that they have, the anxiety that develops, is way out of proportion to the actual danger of those situations, obviously. So this has to have gone on for at least 6 months, and you'll hear that 6 month figure quite a bit. That's 6 months that's tagged on to the minimum amount of time necessary to have these symptoms to make a diagnosis, is really about eliminating transient symptoms, you see. So, does it cause distress? Yes. Does it cause impairment? It certainly can, at least in one or more spheres. Social spheres? Sure, probably. Occupational sphere? Sure, probably. School? Probably. Yeah. Prevalence is less than 2% in adolescents. Females twice as likely as males. Onset typically before 35. It tends to be persistent and chronic, and if left untreated, maybe only about 1 in 10 eventually recover from that on their own. And what we say is in remission. We don't want to use the word cure. Now, the risks for this are about the same as they are in all of the anxiety disorders. In the temperamental risks, we see behavioral inhibition sometimes in children. We see that negative affectivity that we talk about quite a bit, and a sensitivity to anxiety. Okay? Now, in environmental risks, according to the DSM-5, any experience with highly, highly scary negative events, separation or death of parents, assault, abuse, all sorts of things. And in fact, even overprotective parenting can create this disorder. There is a higher incidence statistically that is significant among children who were snowplow or helicopter parented and overprotected than in children who were not overprotected. Heritability has got a fairly high number too. You can look back in the family and see quite a few people that developed agoraphobia. And that's interesting and useful, isn't it? Because if you've got a client who has panic disorder and you find out that not only did other relatives have panic disorder, but many of them developed agoraphobia, you would want to be on the lookout for that and maybe present some ways to avoid developing that. You know, once somebody develops agoraphobia, and if it's severe enough, how do they come into treatment? And what you'll find is that many of them don't. Many of them are not treated. These days, many may come in if they decide they really want help. They may come into the realm of video counseling or remote counseling. There's different ways to describe that. Okay? So what does this come with? What is comorbid with agoraphobia? Well, as you might imagine, other anxiety disorders like panic disorder or others, depressive disorders, post-traumatic stress disorder, social anxiety disorder, substance abuse problems. In fact, you can develop depression on the heels of this or before. You can also have panic disorder. You can self-medicate and develop substance abuse problems. Boy, you can end up with several disorders all in one person. So that's the end of this one.